a brother that I think is not only very well versed in this, but has done a lot of research, a lot of work in this field. Brother Victer Muhammad, thank you for coming and spending a little time with us and taking some of your busy schedule out for us this evening, my brother. So let me turn it over to you and tell us a little bit of something about yourself and give us a little introductory information about this interferon.
Thank you, and thank you for having me.
Yes, sir.
Interferon alpha and beta and gamma belong to a class of proteins known as cytokines. Cyto means tissue or cell, and kine means to move. So a cytokine is a protein that moves across the different cells in the body, carrying a message to do a certain thing. Most of the work that has been done with interferon has been done with interferon alpha. It was first isolated by the Western world in 1955, and it received the nomenclature of interferon alpha because the way you characterize interferon, or the presence of it, is by taking a certain number of viruses in a petri dish or in a controlled environment, and you add a certain amount of interferon to those viruses. And over a period of time of minutes, you calculate the number of viruses that have been killed by the interferon, and that lets you know the concentration or the amount of interferon that's in a particular subject or in a particular matter. And it received the name interferon because it interferes with the enzymes that are necessary for a virus to replicate itself. Thus the name interferon. Ron generally means a protein. So interferon alpha was the first of the interferons that was isolated, hence the Greek name alpha, meaning the first letter of the Greek alphabet. And since that time, it's been used by the animal science industry in the 1970s and 80s to treat beef calves for a viral infection. Then in the late 1980s, a Kenyan doctor, Dr. David Koech at the Kenyan Medical Research Institute in Nairobi, used it to treat sex workers who had been infected with HIV. And he was very successful at doing so. Then in 1990, the Honorable Minister Louis Farrakhan sent a delegation to Nairobi to study Dr. Koech's work. Mm-hmm. When they returned, they brought some of the lozenges that Dr. Koech was using to treat AIDS patients in Washington, D.C. Then in 1994, November, I was contacted by Dr. Abdul Alim Mohammed of the Abundant Life Clinic in Washington, D.C., and he informed me that the Food and Drug Administration had confiscated the lozenges that were being shipped to him. And he asked me if I could do anything to help because the patients were dying with AIDS. I told him, I don't know, let me get back with you. And basically in the synopsis, I was able to take some interferon that was natural, not recombinant, natural.
Yes.
And what we did, you cannot place or distribute 200 or 500 or 1,000 international units of interferon where it is equally distributed in a pill about the size of an aspirin. It's biomechanically near impossible. So I said, that's too unstable, it won't work. And so I was blessed to place it in a solution, a saline solution, which maintains its stability and it's more evenly distributed. where if you take if you take a milliliter or a cubic centimeter, it contains whatever the amount of your concentration that you want, and it remains that way indefinitely. So that was the beginning of my experience with well, that's not accurate. I started working with interferon alpha initially in 1990 as a scientist at the National Institutes of Health. But this was in vitro and in vitro studies in research. We were using animals to test it, mice, rats, and rabbits.
Right.
But in terms of the clinical component, I became involved in 1994. And since that time, we've worked with interferon to develop new strategies for it and new applications. And as of this day, we have used the interferon on as many as 35 different diseases. And some of it is only 2 years old. We didn't know. We didn't know until 2 years ago some of the effects that it had on other things that are called diseases. So that's a brief history, and it's a synopsis of what we've done. It gives you a general idea.
Yes, sir. And for those of you who mentioned, I saw somebody mention that interferon is an HIV medication. Interferon is something that we can make normally in the body. It's just that, as I just mentioned a little while ago, that most people are not doing enough things to do it well. And so, Brother Victer, how would you address people thinking about this interferon and this infection or this virus that we see infecting so many people? What would you say to people that are seeing reports and thinking about using it to help them with this virus?
Well, my response would be this. I've been trained as a scientist for about 37 years, and we are trained to be very careful in what we say to the public. And we're trained that if we don't have proof, not evidence, proof of something, then we don't speak on it. Now, I can give my opinion. It's called an educated guess, because I'm not so sure about the coronavirus, because I worked with the coronavirus 30 years ago, and it did not do what this thing is being reported to do.
Right.
Now, I'll be addressing that more specifically next week during another radio interview. But if coronavirus is a virus, then interferon alpha will work to arrest it. There's no question about it. And the reason I use the word if is because as a scientist, my job is to be skeptical until I get proof.
That's right.
And I can't dissolve myself of that responsibility. So if what people are dying from that is being coined or has been coined as coronavirus, if it is in fact a virus, then yes, interferon alpha will work to arrest it.
Thank you for that answer. In addition, I will say that I have used Brother Victor's supplement before in a patient of mine who was HIV positive, and after 6 months of taking the product and, of course, doing some lifestyle changes, he was seronegative on his HIV exam. And so I believe that I work and try to express myself in the same way that Brother Victor is. We have to have proof of what we say. And so I have to, of course, see this as time goes on to see exactly what his long-term thing is. But that's the reality that I saw. In 6 months, he went from being HIV positive and taking medications to taking the test and being undetectable. So what other problems have you seen interferon used for? And in your experience, what have you seen it do in things like cancer and autoimmune disorders and things of that nature?
Well, 30 something years ago, when I was a younger scientist working at the National Institutes of Health, my supervisor, who was a research veterinarian, and by training, by collegiate training, I'm an animal scientist. But for the last 30 years, I've done biomedical research. And we postulated 30 years ago that that many of the cancers, if not most of them, have a viral infection at their genesis.
Yes.
And the scientists from Harvard who were MDs and the other scientists from your quote unquote elite institutions, they did not agree with us because, you know, he was a veterinarian and I was an animal scientist. But we had studied the brains of cows and sheep that had died from mad cow disease or bovine spongiform encephalopathy and other viral infections. And we had seen the kind of tissue damage from the brains of these animals. And when we went to the hospital at NIH and we saw the brains of some of the cancer patients, and we saw Kaposi sarcoma in HIV and AIDS patients, we drew a parallel because these were very similar. So we postulated 30 years ago that many of these cancers were caused by viral infections. And now it's being reported some 30 years later that, you know, that's true. So in 1994, we started to, I worked with the clinicians in the Washington, D.C. area, and we started to advise the clinician to try the interferon on hairy cell leukemia, HIV, AIDS, multiple sclerosis, breast and cervical cancer, ovarian cancer, fibroid cyst, ovarian cyst, different forms of edema, and some of the other viral infections. And to date, we can report that after 28 years, there has not been one ailment that is termed a disease where the interferon alpha was not successful at either completely eradicating it or at least arresting the problems that the person could recover over time on their own. And there are at least 35, even diabetes and arthritis. And we just found this out like in the last 2 years. We just learned this information. But it's very effective.
Yeah, so I think Brother Victor, in his response, answered a lot of questions that I just went through and saw. So I pray that he did help you all with some of those questions. The other question I thought was maybe something we needed to address is somebody asked if the interferon you are talking about, is it the same as what they're using in Cuba? And is it the same as what they're using in China?
It is not. What they are using, and I'm only going to comment on this because they reported it themselves.
That's right.
I'll comment on it. What they're using is what is called recombinant interferon alpha, or genetically engineered, or GMO. And that does not automatically suggest that it's bad. But what it is, and I can't give you a molecular biology course right now because you would have to have that to really understand. But I'll give it to you. I'll explain it this way. Interferon alpha in its natural state has between 7 and 37 what are called subtypes.
That's right.
Now, what a subtype is, it's a different protein that has a specific function inside an animal or plant's body. Now, when you have naturally occurring interferon in your body, if you've ever had a cold or flu and you had postnasal drip, meaning your nose was running and some went into your mouth and you had this salty taste in your mouth, that's interferon. That's interferon alpha.
That's right.
And so what happens is that when the body produces it with enough fingers where it will address anything that comes into the body. So the different subtypes are for the different forms of a virus. So in 2002, the Washington Post reported that AIDS was mutating and becoming resistant to the antiretrovirals or the cocktail drugs. And I wrote a proposal to get funding to develop a treatment that would treat any form of HIV mutation. I saw that 2002. And I withdrew the proposal because the last time I had submitted a proposal for funding, it was denied. But a year later, I saw that same research come out of China and one out of Johns Hopkins. So I withdrew the proposal. But now, instead of the recombinant or the genetically engineered interferon, it has only one subtype, one. And it does work, according to what has been reported. I have never used it myself, but according to what science has reported and the journals have reported, it does work. It does have high efficacy. So the difference is if it's the natural interferon, the one that we work with, it has between 7 and 32 subtypes, meaning that it'll pretty much take care of anything that comes into the body. If it is the recombinant, it only has one subtype, one form.
That's right. Wow, great information. I see you all are appreciating it as well. Brother Danny, your question, how can we get the interferon? I have the website up for anybody that's interested. If you're interested in it, you can also contact me. I am a distributor of Brother Victer's supplement. And you all know I don't push things for money, but I'm just letting you know that I am a distributor. Brother Victer, you and I have had many conversations about how to eat to live, how wonderful it is, and we also have had many conversations on working together to produce that reality in a way that we can trust and rely on. What would you say to those listening on what they can do to boost their natural interferon that's being made in their bodies?
Interferon doesn't need to be boosted because the amount that the body produces in response to a viral infection is at the picomole concentration. And picomole is a concentration that's 10 to the negative, let's see, 3, 6, 9, 12, 15. I think it's the negative 18 concentration. So that is almost non-existent. Now, I would like to make a correction.
Yes, sir.
The website that you see, you can get the supplement that we sell, and distribute. This is a supplement, a dietary nutritional supplement. So if you eat vegetables, eat onions and garlic, do not eat as much red meat or meat in general, sleep well, drink plenty of water, and things like that. Do not take medication. If you can avoid it, don't take it, because it does deleteriously affect your immune system. It will thwart the immune response. So things like that, being stressed. The average American is stressed because you want 5 cars instead of just 2. So the average American is stressed. The average American overeats. The average American rushes to get to your job. And I'll tell you something to try. When you find yourself feeling anxiety or stress, I assure you that you're compromising your immune system. I guarantee you're compromising your immune system. And when you're stressed, you're taking medication, you're dealing with anxiety, you're in a bad relationship, you're not properly eating, you're eating a lot of meat. What you're doing is destroying your immune system. But if you avoid all these things, when there is a viral infection, then the body will automatically tell the T cells to start producing interferon alpha. You don't have to do anything. Just eat right and live well.
Yes, sir. Very, very easily said, brothers and sisters. But as you know, we have to get to work on doing it. So, Brother Victor, any closing comments, bro? I really appreciate you again. We'll have to come back another time and have a little more in-depth conversation so we can really get into, helping people understand a little more. But as I always say, brothers and sisters, you heard the brother say that he's been a scientist for 37 plus years, and I've been a scientist in a position for 25. Sometimes it's very difficult for us to take all the years of experience and all the knowledge that we have gained and the way that we have to kind of, decipher the information on what is good and what is not. And we try to present it to you all in a way that you can understand. And sometimes it may take us a little more time. So, brother, anything you want to say before we close out?
I have avoided speaking publicly on the coronavirus, and I will continue to do that because there's something about it that doesn't sit well with me, and I cannot accept what the secular society, the media, has presented about it.
That's
because
right.
It doesn't sit well with me. And I will be on the Nat Turner radio program, I think next Thursday on the 28th. And my subject is, does obedience to God eliminate the necessity for vaccines? I'll repeat that.
Yes, sir.
Does obedience to God eliminate the necessity for vaccine? If I were you, I would listen to that because vaccines in their nature are not inherently bad. I want to be clear. Vaccines are not inherently bad. The philosophy behind vaccines is actually good.
That's right.
But until we produce our own vaccine, I don't advise anyone to take it. Not me.
That's
You are grown, you do what you want, but I'm not taking one. And I advise my family not to take it. So we will be addressing that subject because we think that it's necessary to make this subject known to the general public.
Say that one more time. You're going to be on what show? At what time? What day?
The Nat Turner radio show, 7 p.m., Thursday, May 28th. It's a Nat Turner radio show.
And you all, I believe, can find that on Facebook, I'm sure. The Nat Turner radio show and the ads will probably be up there. But y'all put that on your calendar, May 28th at 7 p.m. and check out what Brother Victor has to say. This brother has definitely been somebody I've been in touch with and working with, talking to over the last few years. And we have a lot that we're going to do together. So, brother, thank you very much for coming on. I appreciate you taking some time. And as I said, we're going to do it again. But I really appreciate you coming today, giving us some good information and helping people understand a little more in depth of what they're looking at in these headlines, which, of course, is our responsibility to help them understand. So thank you very much, and we'll see you soon, brother.
You're welcome. Have a good night.
Yes, sir. Assalamu alaikum.
Wa alaikum salam.
So, brothers and sisters, you got a good treat right there, right? I would say. And I just wanted to go back and do one more thing with this lung because I've seen a few questions. And so I'm going to just go to the normal lung picture, answer a couple of you all's questions, and then we're going to move on to the next phase of our show, if you all are okay with that. And I know somebody said they